Catatonic schizophrenia signs and symptoms. A variety of motor abnormalities that fall within the categories of active symptoms and passive symptoms describe catatonic schizophrenia. Active symptoms. Active symptoms are those that entail erratic or excessive motions or activities. Stupor. This is an unresponsive and immobile state. Individuals with catatonic schizophrenia may stay still and silent for hours at a time. 3. Muscle rigidity and tension are referred to as rigidity. While trying to move their limbs, people with catatonic schizophrenia may keep them still for extended periods of time. Posturing is the act of adopting odd or ostentatious bodily poses. Individuals with catatonic schizophrenia may stand on one leg or hold their arms out in front, among other strange positions. Stereotypy. This term describes ritualistic or repetitive motions. It's common for people with catatonic schizophrenia to pace or rock back and forth repeatedly. Passive signs. Symptoms that include a lack of movement or activity are referred to as passive symptoms. Mutism. This is the inability to communicate verbally. Individuals with catatonic schizophrenia may only talk monotonously or be absolutely mute. 3. Negativism is the opposition to requests to move or position the body or attempts to do so. When moved, people with catatonic schizophrenia may resist or take the opposite position from what is desired. Waxy flexibility, sometimes referred to as passive compliance with bodily manipulation from without, is the third type of flexibility. Individuals with catatonic schizophrenia may keep their limbs in an unnatural position until an outside force, such as a therapist, forces it onto them. Catatonic schizophrenia causes. Although the exact origins of catatonic schizophrenia are unknown, it is thought that a mix of genetic and environmental factors is responsible. Genetics. There is data to support the idea that some genes may raise the chance of schizophrenia. According to studies, there is a 50% risk that the second identical twin will also develop schizophrenia if one twin has the condition. 3. Environmental factors. Virus, infection during pregnancy, malnutrition, and early stress have all been related to a higher chance of developing schizophrenia. Brain chemistry. It's thought that a chemical imbalance in the brain, specifically dopamine and glutamate, may play a role in the emergence of catatonic schizophrenia. Abnormalities in brain structure have been found in schizophrenia patients, including larger ventricles, brain cavities filled with fluid, and reduced gray matter in certain regions. Catatonic schizophrenia treatments. Although there is no known therapy for catatonic schizophrenia, there are medications that can help with symptom management. 1. Drugs. The most often given drugs for schizophrenia are antipsychotic ones. They function by preventing the brain's dopamine from doing its job, which helps lessen the intensity of symptoms. The adverse effects of these drugs, however, might include weight gain and mobility problems. 2. Electroconvulsive treatment, ECT. To cause a seizure, ECT entails administering an electrical charge to the brain. It is applied